Good day, everyone! Welcome to Drugs Queen and King Show. I am Velarde, and on behalf of my partner, Alonzo, I will be introducing and interviewing the gastrointestinal drugs, MECLIZINE hydrochloride. How are you, MECLIZINE hydrochloride?
I'm doing great. I'm just having a great time and saving many lives of people who are suffering from nausea and vomiting.
Wow, that's amazing. So I will now start the interview. Are you ready?
Yes, of course.
Okay, so for the first question, besides your generic name, what are the names you are known for?
I am known for the brand names like Antivert, Bonine, Dramamine, Divert, Meclicot, MECLIZINE, Medivert, and Verticom.
What are your drug classifications?
My therapeutic classification is used to block the action of acetylcholine in the brain, thus alleviating nausea and vomiting. And I am also pharmacologically classified as an antiemetic, which is an antihistamine or anticholinergic.
I have heard that drugs are categorized based on their effects on women. What's yours?
I indeed belong to the pregnancy category B.
What is your mechanism of action in the body, or how do you work?
Vomiting is a centrally regulated reflex mechanism that initiates from the vomiting center and the chemoreceptor trigger zone or CTZ located in the medulla. Motion sickness is also regulated by CTZ, and the blood-brain barrier near the CTZ is relatively permeable to circulating mediators, and CTZ can transmit impulses to vomiting center located in the brainstem. Different receptors responding to different factors, including histamine, 5-HT, enkephalins, substance P, and dopamine, are expressed along the brainstem to activate respective pathways and to continue the control of vomiting. Histamine H1 receptors are expressed on the vestibular nuclei and nucleus of the solitary tract or NTS that are activated by motion sickness and stimuli from the pharynx and stomach. When activated, H1 receptor signaling from these nuclei is transmitted to the CTZ and vomiting center. Through its antagonistic action on the H1 receptors, the MECLIZINE primarily works by inhibiting signaling pathway transduction through histaminergic neurotransmission from the vestibular nuclei and NTS to the CTZ and medullary vomiting center. I may also decrease the labyrinth excitability and vestibular stimulation. So I am basically an antihistamine that suppresses the vestibular end organ receptors and inhibits activation of the central cholinergic pathways.
What is your pharmacokinetics, or how does the body respond to you?
I am readily absorbed via oral administration in the form of a tablet, capsule, and chewable tablet, and the peak of my plasma concentration reaches 3 hours post-dose. The volume of my distribution is 7 liters per kilogram. However, the volume of distribution in humans has not been fully studied. It is proposed that I may be excreted into breast milk. In vitro study shows that I am metabolized in the liver through aromatic hydrolysation or benzylic oxidation mediated by the hepatic CYP2DA enzyme, and I am excreted in the urine as metabolized and feces as unchanging drug.
What are your indications and contraindications?
I am indicated for patients with motion sickness as a prevention and treatment of nausea, vomiting, or dizziness associated with motion sickness. I am also indicated for patients with vertigo as a treatment of vertigo associated with diseases affecting the vestibular system.
I also heard that you have adverse effects in the body. What are those?
I can cause local adverse effects in the body. I can cause difficulty swallowing, hives, itching, skin rashes, swelling of eyelids, face, lips and tongue, acute glaucoma attack, and urinary retention. I can also cause thickening of bronchial secretions for the respiratory system, tachycardia and angina for the cardiovascular system, and there's dry mouth and vomiting for the gastrointestinal system, anaphylactoid reaction for the immunologic system, and for the CNS, I can cause CNS depression, anticholinergic effect, drowsiness, headache, and dizziness.
What are the nursing responsibilities that nurses do before, during, and after that you are administered in the body?
Before administration, the nurse should assess for possible contraindications and caution, history of allergy towards meat to avoid potential hypersensitivity reaction, impaired renal or hepatic dysfunction, coma or in semi-conscious state, CNS depression or injury, hypotension or hypertension, active peptic ulcer, and current status of pregnancy and lactation. She should also perform a physical examination to establish baseline data before beginning and during therapy. She should also assess the patient's neurological status, including level of orientation, affect, and reflexes. The nurse should also assess cardiopulmonary status, including baseline pulse and blood pressure. She should also inspect the skin for color and evidence of lesion and rash. She should also examine the abdomen, including the liver, and auscultate bowel sounds. The nurse should also assess complaints of nausea and evaluate emesis, and note for color, amount, and frequency of vomiting episodes. After the assessment, the nurse can now proceed to the diagnosis. Nursing diagnosis related to my application as a drug therapy include the following: acute pain related to CNS, skin, and GI effects, decreased cardiac output related to cardiac effects of the drug, risk for injury related to CNS effects, and deficient knowledge regarding drug therapy. For the planning phase, the patient will receive the best therapeutic effect from the drug therapy. The patient will have limited adverse effect to the drug therapy. The patient will have an understanding of the drug therapy, adverse effects to anticipate, and measures to relieve discomfort and improve safety. During the implementation, the nurse should assure that the route of administration is appropriate for each patient. The nurse should also assess the patient carefully for any potential drug-to-drug interactions if giving antiemetics in combination with other drugs. She should also provide comfort and safety. The nurse should provide support and encouragement as well as providing thorough patient teaching. After the administration, the nurse should monitor the patient's response to the drug if there is a relief of nausea and vomiting. The nurse should also monitor for adverse effects like dizziness, confusion, GI alterations, cardiac arrhythmias, hypertension, gynecomastia, and the photosensitivity. The nurse should also be able to monitor the effectiveness of comfort measures and compliance with the regimen. And she should also evaluate the effectiveness of the teaching plan.
Wow, MECLIZINE hydrochloride! I have learned so many things with this one-on-one interview. Thank you so much for gracing this show with your presence. And I hope you guys learned a lot too. See you on our next episode. Goodbye!